My name is Amol and I'm co-leader of Evaluation and I'll be your moderator for today's session. So before we start, let us fix some ground rules. Kindly rename your Zoom names in this format: first name space last name, and you can also add your gender pronouns in the bracket. And please keep your camera and microphone muted during the session, especially when the resource person are speaking. And you can post your questions in the chat box. Our team will try to address all the questions in the Q&A session. Uh, so, as we all know that there is more and more push towards community-led evaluations, where we transfer power towards communities and where we do not treat the communities only as mere research subjects, but as an equal party to the evaluation. And in this context, the qualitative methods become very, very important because the qualitative methods capture nuances that sometimes quantitative methods may not capture. The context, the culture, the stories, and various dynamics in the society, the communities, the qualitative methods can easily capture, and that's what we are going to focus in today's session. And the training objectives for today's session is to enhance knowledge and skills in the qualitative methods for community-led evaluations and to strengthen the evaluation network in Asia Pacific region. So I would like to invite Tashi Chodan. She is co-leader of Evaluatia for the opening remarks.
Thank you, Amol. Good morning, good afternoon, and good evening to everyone joining us from across the world. On behalf of Asia Pacific Evaluation Associations, I extend a warm welcome to each and every one of you to the 10th follow-up sessions of our winter school program. Since its inceptions in May 2022, these follow-up sessions has been a journey of continuous learning and growth. And we have successfully completed like 9 sessions, and each contributing significantly to our collective knowledge and understanding. So today marks another milestone. So as we gathered for yet another enriching sessions. So I would like to express my gratitude to all of you for dedicating your time and energy to be part of these sessions. And our gratitude extends to our even speakers whose expertise and insights will enrich our discussions. So I'm confident that today's sessions will be both engaging and informative. So the perspectives and experience shared by our speakers will undoubtedly contribute to a deeper understanding of our subject matters and further enrich our professional's journey. So once again, I extend a warm welcome to each of you. So let's embrace this opportunity for learning and growth. So together, let's make this truly enlightening and impactful. Thank you, everyone.
Thank you, Tashi. So let's welcome our resource person for today's session. As Tashi has mentioned, this is 10th follow-up training, and for today's session, which is basically focusing on qualitative methods in community-led evaluations. The resource person for today, we have Eileen Kluta. She is the Director of Research and Advocacy at Outreach International. Then we have Nancy Bobadilla. She is the International Facilitator at Outreach Philippines. Then we have Wanja Gonzalez and Agnes Carlos. They are Human Development Facilitators at Outreach Philippines. So a very warm welcome to all the resource person, and I would like to give the stage to Eileen and the team to take over. Thank you, Eileen.
Thank you so much, Amol. I'm going to go ahead and share my screen. so that you all can see our Canva that we prepared. Amol, can you give me a thumbs up? Are you all seeing my screen? There we go. All right, so now I'm just going to turn it into presenter mode and we can get started. So from our side, also just a warm thank you to Amol, the team up here, and also all of you in attendance today. It's always such a privilege for us to present our work and our experiences to you all. So thank you so much for this opportunity. We are very excited to be here today. As you've heard, and also through the advertisements for this session, we want to share with you today a little bit more about how we have experimented and also used qualitative methods within our work, specifically as far as community-led monitoring evaluation is concerned. And I do here also want to emphasize what is so amazing about this session is it comes directly from the experiences of practitioners. So folk like Agnes and Red, who work directly with communities, they are going to share their experiences with you. And then we're also going to hear from Nancy, who is who is integral to these sessions and these facilitations across different spaces. A little bit about us. I work for Outreach International. We are an INGO based in Kansas City, Missouri, here in the US. And then Nancy, Agnes, and Red, who you will meet shortly, they are from Outreach Philippines Incorporated. If you want to learn a little bit more about their organization, you can click on this QR code here. It should take you to an advertisement, but just past the advertisement and then you will get to their website. And if you are curious what they have been up to as an organization, a nonprofit in the Philippines, you can also click on there and use the next QR code to go look at their capacity statement for 2023. And I do also want to mention this, Nancy is currently in Cambodia supporting our program partner there, and Red and Agnes are in the Philippines, based in the Philippines. Red supports currently a community called Santa Lucia Old. You will hear him mention that throughout his presentation. And Agnes supports a community called Santa Monica. Both Santa Monica and Santa Lucia Old are neighboring communities, so very close to each other located. And both Red and Agnes started their intervention in community development within these two locations in 2023. I'm going to now turn it over to my esteemed colleague and co-pilot and all of these adventures that we do in community-led monitoring evaluation, to share a little bit more with you about the objectives of our work, specifically as far as community-led development is concerned. Over to you, Nancy.
Thank you so much, Eileen. And first of all, good evening, everyone from Cambodia. My name is Nancy. So, in our community-led development work, we focus on three major objectives. First is to support communities in identifying and resolving their most common pressing issues. 6, solutions where the results are usually projects that they themselves manage. And then second is to support communities in establishing and strengthening community-based organizations, or CBO, which serves as a mechanism to carry out activities that sustain their issue and project development. And then third is to raise and strengthen community members' consciousness and capacity to manage their group and its activities and sustain such activities after OPI, or Outreach Philippines, has concluded its official CLD programming. So where does M&E fit into our work? So monitoring and evaluation is central and embedded in the methodology that we use in our CLD programming. So this is what we call participatory human development, or PHD methodology. It goes through a repetitive process of knowing their situation, and that includes, of course, data collection, and then analyzing, deciding, and planning, and then acting, and then evaluating, and then reflecting on the results and impacts of the action or interventions. So in each step of this PHD process, we make sure that the people are consciously involved, meaning they are interested and aware of the need to be involved. So for instance, in facilitating a community-led project development, Our field practitioners like Red and Agnes, they work consistently with community members to facilitate development and establishment of projects that they think are best solution to address their identified poverty issues and needs. So for example, Red and Agnes will share later an example of such an issue and its corresponding project. In this case, the issue of food insecurity and then the corresponding rice loan project. And this is the case for both Santa Monica and Santa Lucia. So we make sure that the project recipients recognize their ownership over the project they developed and implemented. How? By ensuring that they are involved in implementing the community-led M&E process. And the steps of such a process can include, number one, review of the issue and the project goals and objectives, and that includes developing the overarching evaluation and research question. Yes, thank you again. And number two is identify and develop data collection tools or survey. Number three is pre-testing or role-playing data collection. And then number four is actual data collection. Number five is data encoding and formulating data summaries. In the case of quantitative data, this can include accessing the summary report through an application. And number six is data analysis and validation. And then number seven, lastly, is data dissemination and usage, let's say in project proposal or in project report making. Now, please take note of this process. Agnes and Red will show later how they facilitate it with their community leaders. So the involvement of the people, next slide, please, Eileen. So the involvement of the people in this process builds their capacity on how they will advocate for themselves, such as how they will use their data in the development and submission of project proposals, or how they will use their data in project impact assessment or evaluation, or how they will use their data in the preparation and submissions of project reports, etc. So if people are involved in the process of M&E, only then can we expect them to have ownership over measuring project successes, outcomes, and impacts, and therefore the sustainability of their participation in this repetitive process of issue and project development. So what method and data are we using in facilitating community-led M&E? We have used quantitative data in supporting our community's M&E initiatives and efforts. We introduced a digital application like Kobo Toolbox in data collection as an option. We train community leaders on how to encode surveys in Kobo Toolbox form, how to use their cell phone in data collection, how to access reports, etc. However, we are getting complacent with questions related to how many of who or how many of what, how much, how long, etc. in collecting data that they can use, let's say, for project proposal making or for project impact evaluation and reflection. And until recently, we realized that quantitative data is not enough. We recognize that there's a set of questions missing. What about the questions around how a particular situation or intervention makes people feel? So qualitative data and methods are one approach to respond to these kinds of questions. We started to reflect on how we can incorporate such methods into our process. We wanted to not only draw from the typical qualitative methods and tools, but we wanted to experiment with them to identify tools that are culturally and socially relevant and appropriate for the context that we work in. We are not only curious about methods as far as data collection is concerned. Our tools should also extend to the analysis part, and most importantly, processes of local validation. So after analysis, it is very important that community members validate the analysis and synthesis of the data so that we have a deep agreement that the analysis and synthesis reflects their situation. So the trustworthiness of the data as well as the analysis, we value this greatly. So we then identified some methods, and I want to give it back to you, Eileen, to further elaborate what did we do and how did we do it. Back to you, Eileen.
Thank you so much, Nancy. Let me just get us to the next slide here. There we go. Yeah, so as Nancy shared, for us, our choice in qualitative methods are very much informed by both the appropriateness of the method for it to be culturally sensitive and socially relevant, but then also how appropriate it is to allow for local and participatory forms of analysis and synthesis. And one such method that we wanted to think through and also incorporate is photo voice. So what is photo voice? Typically, it's used across different spaces within the social sciences and in an applied and also in a more theoretical way. The researcher would ask participants to, in response to a particular research question, take a photo or make an image to respond to this particular question. And what is so amazing about the method is that this then allows people to have a deeper moment of reflection in response to that question through imagery, and whether that's an image or then a summary of a particular image. And then these images become a representation or a data point for people's deeper underlying understanding and also interpretation of the world. What then happens is through the data analysis process, people would then provide a description of their image. The researchers and the research team would then code those descriptions and the images. The next step would be sorting and categorizing those codes into deeper overarching categories, and then eventually collapse those again into bigger overarching themes, as is the typical process within qualitative analysis. And often those themes can be very reflective of a middle range kind of theory. We have seen this happening within Red and Agnes's context, that this kind of analysis is very much possible to do. Now, we have used photo voice and various iterations of it in the Philippines, Cambodia, and also in Nicaragua. We have seen uses of it in a more pure form, but then also different forms of adaptations. Like you would see in Red's presentation, the community members decided to draw pictures instead of taking photos. And then, as you would see in Agnes's case, the groups decided to combine their photo voice experience with more traditional methods like focus group discussions in order for them to get deeper into their realities and then transforming that into very deep and rich data points. Now, we are going to learn from Red and Agnes shortly on how they've used it. But before we go into that section, I just want to again refresh your memory on this process or this framework that Nancy shared earlier, because this is going to be the frame onto which Agnes and Red hang their presentation and also their sharings with you. Okay, so now I'm going to hand it over to Agnes. Over to you, Agnes.
Thank you so much, Eileen. The issue we will share more with you about today is food insecurities within the rural Philippines. Nearly 51 million Filipinos face moderate or severe food insecurity in 2020 to 2022, which is the highest number in Southeast Asia. 1 out of 10 Filipino households experience food insecurity. This is ironic considering the Philippines is the 8th largest rice producer in the world, accounting for 2.8% of global rice production. Yet, Philippines is projected to remain the world's top importer of rice this year. Both Santa Lucia Old and Santa Monica are experiencing food insecurities. Although these communities are one of the rice-producing areas in the province, where each family could potentially have enough rice, but they don't, because most residents do not own land and rely on farm labor. All of this then makes it very obvious that people in the communities where Red and I work will surface food insecurities as one of the most pressing concerns. Just like what Ate Nancy mentioned earlier, we field practitioners work with people in the community by facilitating the development of their identified projects as a response to the issues they want to address. And using the framework Ate Nancy's mentioned, here's what we did in Santa Monica. Step number 1 is reviewing the issue and formulating the questions. Once the community decides to discuss a particular issue, we do the following. First, we do what we call groundworking. That is, visit people in the community individually. Here, we enable people to participate in an upcoming community meeting. We ensure that people can express their views and experiences regarding the issue they want to discuss and encourage them to share this in the general meeting. Then, we facilitate an issue analysis and planning meeting. During this meeting, community members share their perceptions and experiences about the issue, assess it, and come up with an action plan on how to address the problem. This is also during this meeting when we facilitate with them the value of data, not only for knowing the issue in a more detailed way, but also that they can include such data in funding proposals for their projects. But to know what data, they have to formulate first what are the questions. So we then develop with them research or evaluation questions that are most pressing to them and will guide their monitoring and evaluation activities. In the case of Santa Monica, the questions they develop to better understand food insecurities are, first, what is the current situation in your community with regard to food insecurity? And second, how does food insecurity impact you as a mother and you as a family? These questions were developed during the General Assembly. There were about 83 people present during the meeting. Next is finalizing and developing data collection tool. After we develop our research questions, I introduced to the group Photo Boys, and I asked what they think would work best. They were excited about the method and saw the possibilities of how this can really get to the data they would want to collect. They then said that taking photos is something that they really like to do, but they decided that they want to modify the process to add workshops, or in other words, focus group discussions. And then also staging the photos so they truly reflect the discussions they would have, a kind of photo boys masa. Santa Monica has 5 hamlets. The group and the leaders decided that the data collection will happen per hamlet. They then assign a team leader and additional 2 leaders for each hamlet who will be in charge of the data collection. They went home after the meeting, and in their respective hamlets, the assigned leaders conducted workshops with about 4 to 6 people per hamlet. Total participants across all the hamlets are 25. Each group was provided with the materials to use in their workshop, and they were given enough time to complete the entire process. Step number 4 is data collection and encoding. In each of these hamlet groups, the assigned leaders then facilitated workshops in response to their overarching questions. They did it in the following way. First is listing.
Agnes, you are muted.
Okay, sorry. First is listing. They discussed the questions in their respective groups, and then they wrote down their answers to the questions that needed to be addressed. Then they brainstorm what appropriate image could illustrate their answers. Second is action planning to collect the images. They identified what needed to be done and who would be responsible for each task, like actors, props manager, photographer, presenters, etc. Third is photo shoot. The actors would portray their character while they're being photographed. Some collected the available pictures from their gallery or Google, other took pictures of things, events that can be seen around. Next is photo printing and photo arrangement. When they had completed the necessary photos, they sent them for printing, and when it was returned as printed copies, they glued them in a crop paper and added captions. And aside from the captions, there were also leaders who wrote detailed explanations on a separate sheet of papers that would they use as a guide on the day of presenting it. This made them ready for the presentation. All of these activities took about a week, and then all the groups came together to present, analyze, validate their data, and it was happened in step number 5, which is the data presentation and analysis. All 5 groups presented their output by showcasing their materials along with explanations for each image they displayed. And after all the presentation, it was time for a second round of analysis. As expected, there was a lot of overlapping in the data between the different groups. The participants recognized this overlap, seeing that the topics discussed in one group were also present in other groups. I then asked them to identify overarching categories that can help consolidate their different topics. They then identified these overarching categories as the following themes: food security, health, education, livelihood, and employment. The next slide shows some of the images in each theme and its impact to them. In food security, because food is not adequate for everyone, priority is given to the children, and if there's any excess, it goes to the adult. Sometimes they only eat twice a day instead of the usual 3. Others resort to cooking noodles and porridge because they are cheaper than rice, and it also feeds more people and does not require additional viands. In education, some children need to help their parents to do their livelihood. The money they will be using in school is being used for food. In health, food insecurity affects the physical and mental well-being of the people. This could lead to nutritional deficiencies in children, make them sick and skip attending school. And for the mothers who are constantly in charge in preparing the meals for the family, are experiencing stress and excessive worrying when food in the table is not enough. In employment and livelihood, one common strategy they do to address food shortages is borrowing from local stores, merchants, or lending institutions. However, this way further complicates their situation because they have to pay additional interest. We place these overarching themes on the wall of the meeting place, and then the different groups place their captions under each of these themes. We then ended up having a wall with 4 themes, under which was all the captions linked to the photos they took. Next step was data validation. To validate the data presented, I asked them the following: do these categories or themes illustrate and represent the photos you presented and also the discussions you had in your workshops? I also asked them whether we missed something or if there was something there that they perhaps did not discuss in their groups. Then they confirm that their discussion and images are correctly reflected in the overarching themes. We therefore validated the data as a group. Last step was data dissemination and usage. In addition to the qualitative data, the group also collected quantitative data. Last March 21st, the group used both sets of data and included it into a proposal through which they are requesting funding for a rice loan project, which they, depending on getting the approval, will implement and manage themselves. Included in their proposal is also a monitoring and evaluation section. In there, they shared with the funders that they already have baseline data on their current situation. Following the implementation of their project, they will then collect data again using the same methods they did for their baseline to illustrate the extent to which their project has been impactful. The final slide you will see now is an overall reflections from the group about the process. I asked them these questions. What is now the use of the data you have collected, presented, and analyzed, and how do you feel about it? And these were the answers. We are happy because we now have the data that we can use for writing the project proposal. The images we have seen and the explanations we have heard are reflections of our current situations. That for a long time, we have been experiencing this, but we have not been given the opportunity to discuss it and find solutions together as one. We have been individually finding ways and seeking solutions. This is the first time we have collectively discussed it. So that is the entire process we went through in Santa Monica in gathering sufficient and accurate data about their situation on food insecurity. Thank you. Now, let me call Red to share their process in Santa Lucia.
Thank you, Ate Agnes. Good morning, good evening again to all of you. So as Ate Agnes following the 7 steps process in community-led and monitoring evaluation, in Santa Lucia Old, we followed the same process but with some slight variation. So Santa Lucia Old has the same issue in Santa Monica, which is insufficiency of rice. So following step 1, I, as a field practitioner, I also went to ground working for a house-to-house visit to ensure that the people will participate in a meeting discussion. Then we proceed to the issue analysis and planning as Ate Agnes discussed earlier. And after, I facilitate with the people the formulation of questions for qualitative data. They were able to identify 3 questions that will provide data in their project requests as a response to the issue of rice. So question number 1 is, why do you need a rice loan? What is your current situation? Question number 2, what is the effect of the shortage of rice on you as a mother, on your family, and how do you feel when you experience this? Question number 3, as a mother and in your family, what is the effect of the price increase of rice in the Philippines, and how do you feel when you experience this? The group developed these questions during General Assembly. There were about 80 people present. These kinds of questions primarily refer to the emotions, experiences, and actual situation of an individual in the community. It cannot be measured by quantity or amount, but through understanding the feelings, needs, and effects of issue on people's lives. The answer of these questions describe the personal experience and perspective of individual affected by these issues. Nevertheless, how will the community answer these questions? We jump into step 2 and 3. So during General Assembly, we introduced to them the methods of drawing. Through drawing, they can express their feelings and emotions better to answer the questions. Drawing is quite challenging for the community members, but because they have guide questions, they become creative in thinking to answer the questions. One member of the community said they feel like they're back in school because they are thinking deeply to answer the questions through drawings. After I facilitate the formulation of these questions, the groupings were established. This was also during the General Assembly, and we divided the participants into 4 groups. So each group consisting of 20 persons, and they started informally brainstorming the evaluation questions. Each group was able to identify their group leaders, And after that, they brainstormed ideas or answer to the questions, and the people went home. And then the next few days, the assigned leader and selected group of 6 to 8 people per hamlet then finalized the drawings, producing with a total of 4 groups drawings. So this means the sample participants were 24 people. Each group provided materials in drawing, so it will be more creative and colorful. Then we proceed to actual data collection. The group spent almost a week doing this activity. They did their drawings in group and individually. In the community of Santa Lucia Old, there were 4 groups who presented their drawing in General Assembly. Each group has their reporter who presented their output in the group workshop. Each group collected their insight, thoughts, and feelings with regards to the 3 questions that they need to answer, and the group leader were consolidated it. Each group answer is written on a piece of paper in full to ensure completeness and to make sure that during the presentation, the reporter will not forget any data provided by the group members. Then we jump into step number 5. So in this process, each group presented their drawings as the response to each question in order to bring out the creativity of the community members. So each drawing that they presented, they were able to express their feelings and authentic situation. And each group explained their drawings. They also included the analysis of their presentation. In summary of their analysis, it is evident that their drawings targeted various aspects in education, in malnutrition, in livelihood, in economic, and emotion, and mental health. Slide above all, the most severe impact of this issue is the deep concern of parents when mealtime arrives. They become restless, constantly worrying about where they will get food. What's worse, sometimes the spouses end up arguing due to having nothing to eat, leaving their minds unsettled in this situation. All these statements were confirmed and validated by all the community members. So that is step number 6. And during their presentation, you could see and feel the atmosphere in the meeting center where everyone was deeply affected by those statements. Some of them even shed tears while explaining their drawings. I believe there are many ways to gather qualitative data, but I strongly believe that the methods of drawing is one of the effective ways to bring out the true and authentic quality of data. Once the necessary data is in place, we now proceed to step 7, the data usage and dissemination. The proposal making process can now proceed. So this method makes it easier for the community group to create their project proposal because if contents came directly from them, they validate it, and they will be the ones using this data. Writing their proposal becomes easier through this process because they have been given time and opportunity to explain the real situation, ensuring their proposal is not based on estimates, but on a genuine and credible information. So that is the framework that we use in the community of Santa Lucia. And now I would like to share my biggest takeaways and learnings through this process. So first is establishing trust. Building trust within the community is paramount. When people in the community truly trust you, it becomes easier for them to express their feelings, knowledge, and experience. This involves transparent communication and active listening. Next is adaptability. Remaining flexible and adaptable to the evolving preference of the community is crucial. They are open to feedbacks and necessary adjustment just to ensure that the data collection process remains inclusive. This means we must be adaptable too. This includes being responsive to changes in schedules, locations, or methodologies to accommodate the needs and preference of the community members. Next is empowerment through genuine participatory approaches. Genuine participation is letting them share their stories, share their experiences, perspective, and priorities. Involving community members from the beginning ensures that the data collection methods are culturally appropriate, relevant, and acceptable. Next is data ownership. Facilitating discussion with community members about the findings of the data collected empowers them to identify priorities and advocate for change. It allows community members to provide input throughout the data collection process. Next is capacity building. Investing in building the capacity of the community members not only enhances their skills, but also strengthen their confidence in contributing to the data collection process. And the last is sustainability. Planning for the sustainability of community-led data collection initiative is crucial for long-term impact. This involves identifying local resources, building partnership, and empowering community leaders to continue the work beyond the initial projects. So now over to Ate Agnes to share also her takeaways and learnings about the process.
Thank you so much, Fred. So here's what I learned about the process we did. First is embracing innovative approaches and tools for data collection and evaluation. I saw authentic participation in explaining every picture they presented. It was very clear that they described their real experiences and situations. They didn't just label. Instead, they connected them to actual events, circumstances, and emotions that people have encountered for so long. By doing so, they made their presentation more relatable and understandable because they anchored it in the realities. Incorporating photos into data collection methods can increase engagement and participation of the respondents. Participants may feel more involved when they are encouraged to capture visual data themselves, leading to richer and more diverse data collection. Photos are also a versatile data format that can be easily collected, shared, stored, and accessed across different platforms and devices. They can be integrated into various data collection tools and methodologies, making them accessible to a wide range of researchers and participants. Second is the importance of data analysis and validation in the process. It is an essential component in the data collection process, ensuring that the data is analyzed accurately and collectively, leading for decision-making and planning for the next actions to take. That's all again, thank you. Now, I will pass it on to Eileen to sum it up and share some top tips and principles for implementing and working with qualitative methods in community-led contexts.
Thank you so much, Agnes. It's so wonderful for me to sum up what Agnes and Ray just shared in basically 4 tips and principles. There are so many more, but for me, these 4 is a true reflection on what we can use and what we can learn from what Red and Agnes just shared. I think the first one is about flexibility, adjustability, and adaptability. We need to make sure that the methods we choose within community-led practices are culturally appropriate and also responsive. They have to be adjusted and adapted so that local people feel comfortable and that it's normalized for them as an approach for data collection. The second and the fourth tip here go very hand in hand, but the second one is to make sure that what we do is mutually beneficial. It's not only beneficial for us representing organizations or funders, but that it's also beneficial for local contexts and for those people locally being involved in our practices. And for us, sort of a guiding principle here is nothing about them without them. If we engage local communities in data collection efforts, they should be in the driving seat of such processes and such activities. And we should choose our methods then also that they allow for collaboration. The methods we choose should enable very authentic and natural collaboration, participation, and not only in certain periods or certain places within the process, but from the design all the way through to the data dissemination and putting the data to action activities. And then lastly, we must always and continuously reflect on ownership. To what extent are we, through our activities, the methods that we choose, the methods that we deploy, to what extent are we ensuring and enabling ownership, local ownership, not only over the process itself, but then also over the data that emerge from the process, so that local communities feel that this is the data that represents them, but then also that this is the data that they need and that they will deploy and use in whatever way and shape and form that they so pleased to use it. Okay, I'm going to conclude there. Thank you very much again for this opportunity, Appia, and for all of you all attending so early and so late in different parts of the world. We look forward to hearing whether you have any questions and answers. So I will now stop sharing my screen and hand it over to any questions and answers.
Yeah, thank you so much, Eileen and team. Let me share my screen first. Okay, so that was a very elaborate presentation about those programs, and I hope people must have some questions. So please ask your question in the chat box. So there are a couple of questions in the chat box, so I'll just ask you one by one. First question is how to effectively collect data from physically challenged individuals, and suppose qualitative data.
That's a great question. Thank you so much for it. I'm going to just quickly phrase it, and then I'll maybe hand it over to you, Nancy, to also respond. I think it's all about choosing your methods wisely, right? Choosing methods that are responsive to those people and what they feel most comfortable to participate in. We know that there are very many methods out there that we can use, but we can also adjust them and we can also adapt them so that people with disabilities can use them. For example, people that are hard at hearing, they would be more using visually forms of data, right? And vice versa, you can also do audio things that can be very, very creative. Nancy?
Yeah, I agree with you, Eileen. And also in our CLD approach, we make sure that in our approach it is inclusive, you know, and we make sure, as Agnes mentioned earlier, we do groundworking, and in our groundworking we visit the community people, the members of the community, house to house, and where, you know, in our groundworking, it is where we tackle with the people the specific issue or issues that they are affecting most, and we are not just focusing on a specific sector, but it is based on issue. So during our groundworking, if, like, for example, in one household, there is somebody who is physically disabled and not able to participate in the discussion, for example, and we make sure that at least the members of that household can participate in the discussion, in the activities, so that the issue of the disabled household member will be included in identification of their issues in the community.
Yeah, thank you so much, Eileen and Nancy. So there is one more question from Prateek, who's asking, what is middle range theory?
Thank you so much for that question, Pratik. It's a wonderful question, and the difference between high-level theory, like you all have probably been exposed to in theory classes in school and so on, and middle-range theory is a very unique but also very important distinction. Middle-range theory, as I see it and I use it, is a kind of theory and a kind of abstraction from empirical data that's still very close to the data. As you saw in the abstraction that happened with Agnes and Red's analysis in their communities, the themes that emerge can already provide you a kind of theoretical oversight of what's going on in their communities. Those themes are about education, about health, about livelihood, right? So they are already abstracted, but they are still very, very close to the empirical data. They are not, for example, like a theory of self-determination or theories of motivation. That's a very it's a higher level of abstraction. And I think a middle range theory and middle range theory development is also something that community members can very much relate to, right? If you theorize with them about education and the link between that and not having access to food, that's a relatable aspect for them. It's not as abstractive as, for example, other higher level theories like behavioral theories or social psycho theories and things like that. Thanks for that question, Pratik. It's something that makes me very excited.
Okay, so I have a few questions to ask. So one question is when we go to communities, like say in the context of indigenous communities who speak a different dialect maybe or different completely different language. So how to address the barrier of language while collecting the data?
Agnes, Red, Nancy, within the context of the Philippines where you worked, it is my understanding that the language, that you have not necessarily come across language barriers, right? Because the language you have used is the same as community members, correct? What we have seen, however, in other contexts, Nancy, in Cambodia, for example, their language has not been has not really restricted either, because the facilitators have used Khmer and the local communities speak Khmer, right, Nancy? To be honest with you, we have not really truly done this form of qualitative forms of community development or use these methods within contexts where the language of local people are not the same as those of the practitioners doing it. But I still think it's not necessarily a barrier that should keep us from doing it. I think there are very, very creative ways of still enabling conversations around this. But I want to stop there because I'm curious to also hear from Nancy, Agnes, also you and Red. Maybe Nancy, if you can jump in.
Yeah, based on our experience, because we haven't yet experienced deploying our field practitioners in a community where they can't speak common language or common dialect, both like in the Philippines or here in Cambodia. We make sure that at least the field practitioner can understand and can speak the dialect of the locals in the community.
Yeah. But thank you, Nancy, but we are not worried about that, right? We should not stop short from that. We should still work to make sure that local people own the data and see how we can overcome that. Technology is great, right? So technology can help us.
Okay, we have one more question from Greggy. Greggy is asking, what strategies do you use to support capacity building of communities in terms of data analysis and dissemination?
Thank you, Greggy. Nice to see you here. I will start off on that capacity process. Greggy, in our approach or the methodology that OPI uses and also all the other program partners, we do on-the-job training. And that's how capacity development takes shape. We don't make explicit like a classroom style, everybody sit down and now we're going to learn analysis. It's very much on-the-job training. And people might not consciously be aware of them gaining the capacity to do data analysis, whether that's quantitative or qualitative, but that form of capacity development is emerging. We recently, and I want Nancy to also respond to this, we recently did a pre and a post self-assessment in Cambodia, where last year we asked them to what extent they feel comfortable facilitating community-led monitoring evaluation. These are community leaders. And we asked them this year again how they feel, and there has been a significant improvement in their self-assessed-ness of their abilities to do this kind of work. And all of that has happened through on-the-job training. Them actively being involved, doing it, that kind of I'm now blanking on the psychological word of that, but on the job kind of training. Nancy?
Yeah, and it's also amazing to observe, like for example, here in Cambodia, to observe leaders, who have not attained higher level of education, but they can learn using gadgets like laptops, and they can learn how to, like after collecting their own data, they can learn how to encode it and into an online digital application like Kobo Toolbox. They can learn that, and they can also learn how to use their cell phone in data collection, and how they can download those data into Excel, and how to create graphs, to make the information more visuals for their community members. So it's really amazing to observe that here in Cambodia.
Thank you, Nancy, and thank you, Eileen. We are just finishing our time. Okay, we'll take a last question and then we'll. So there's a question from Anarma. She's saying, how did you encourage the community people to collaborate on data collection?
That's a great question. Nancy, I think we should hear from Agnes and Red. How do you encourage people? Maybe first, Agnes?
Yes, thank you for that question. Actually, this is not that easy to do for us, the field practitioners, but in our work, we always value participation as one of the principles of our methodology. That is why we ensure to follow the steps when working with the people. And as I have said earlier, our objectives in groundworking is to partially have discussion to individuals so that they can participate, or they can engage in the general meeting that will be the next activity. And how can they possibly do that if we are strangers to them? Of course, they will not allow us to intervene in whatever situation or perspective they have. That is why we have to integrate first. This is very crucial to build rapport and gain trust from them. So if this will happen, our work with them, we need to continuously do our integration in not only in a day, but a work in progress we need to sustain. And when they have this trust to us, they will become more comfortable in communicating, participating, collaborating, etc. With us and also with the people in their community. It will be easier for them to share their thoughts, feelings, and suggestions to any data that we will need or they will need to collect in the process they need to do.
Read anything? Thanks, Agnes. Read anything from your side?
Yes, this is very beautiful questions. So first, you have to know what data you should to be collect. Okay, so for us, we are investing the trust and relationship to the community. In our work, we do the issue base. So if people are affected by those issue, of course people will participate for the data collection. But that's not the point. Of course, we as field practitioner, we are living in the community. We are building their trust, making a deep relationship to them, so they can share what stories that may have. So as Ate Agnes, integration is number one, and of course the groundworking. So all the sentiments, all their opinions should be validated and participated in the data collection process.
Thank you, Red. I think just to add to that, Amol, I think if it's an issue, the research questions, if the main objectives are very clear to them and they feel they have ownership over it, it's going to be not taking that much encouragement to get them to participate, right? Because they have buy-in and they understand the importance of the process. So
yeah, absolutely. Yeah. Thank you so much for the sharing. So we'll just move to the next segment, which is group picture. Okay. The most fun part of the session. I'll stop sharing. I'll request everyone to please switch on your cameras and with your beautiful smile and beautiful faces. Please let us know when the photo is been clicked and when it's over. So we'll smile.
Yes, please everyone open your camera. Okay, smile. Okay. Yeah, thank
Thank you, Ahmed. Let me share the screen. Okay, so next is I would like to invite Madhuka. She's a coordinator of APIA for the closing remarks. Madhuka.
Yeah, thank you, Amol, and good evening, everyone from Sri Lanka. So today we have come to the end of our 10th follow-up training for winter schools and fall school participants. And today we discuss about qualitative methods in community-led evaluations. And it was really interesting, and we were lucky to hear from our expert practitioners from Outreach Global and Outreach Philippines, who actually work with the communities. And it was really great to hear about some interesting methodologies such as photo voice and drawing methods that our expert team has actually used in the field in 2 cases in Santa Lucia Old and Santa Monica in Philippines. So on behalf of the organizers, I would like to thank our resource team today, Nancy, Eileen, Reed, and Agnes. Thank you so much for spending your time with us and sharing your valuable experiences with our participants. We really appreciate that. And then I would also like to thank my dear colleagues, Tashi Jordan from Evaluate Asia for giving us opening remarks, and my dear friend Amol Shaila Shulesta from Evaluate Asia for moderating today's session. And the last, not the least, dear participants, thank you so much for your active participation today. And we really appreciate you joining us with today, despite the fact today's been a holiday for many parts of the world. We hope that you had great time with us. You had chance to learn some new things from our speakers today. And we hope you will also join with us for the next session in July. So thank you, everyone, and have a nice day and have a nice Easter. Thank you, and over to you, Amol.
Thank you, Madhuka. So yeah, as Madhuka had said that our next follow-up training is already scheduled. The 11th follow-up training is scheduled in July, on 11th July, and it will be on culturally responsive evaluation. It will be by Catherine and Moses, moderated by Ayush Makharia. So the details will be shared with you all soon over the email and our social media channels. Next is for those who don't know what Manila Declaration is, the signing of Manila Declaration just happened in the fourth APIA conference in Manila, Philippines. And basically the Manila Declaration is the collective commitment of all the evaluators or those who in the evaluation space for the for evidence-based for the institutionalization of MNE for evidence-based policymaking and tracking sustainable development goals. So we request all of you to please scan this QR code, go through the Manila Declaration once, and please sign the declaration. You can also access the declaration on the APIA website. So please do sign the Manila Declaration. And that's the wrap. Thank you so much. Thank you so much all for joining. Thank you so much for outreach team, Elaine, Nancy, Wanjo, Carlos, and everybody for joining. Thank you.
Thank you, everyone. Thank
Yeah,
you.
thank you.